Welcome back to the King's Podcast, the Wellness Dive with Lackie. I'm your host, Esther Lackie. Now, most of us women, and might I add a few men out there, sometimes we wake up with back pain. It can persist, it can go away after a few minutes or a few hours, and sometimes it can just go on and on and on. But then again, do we go to the hospital? I don't. I don't know about you. And then again, do you know what kind of back pain that is? No? Okay. Today we are joined by Dr. Tharaq Barami, consultant rheumatologist here at King's, and he'll be taking us on a deep dive into back pain. Not just any back pain, but inflammatory back pain that can lead to stiffness. Dr.
Thank you.
Tharaq, or should I say Dr. Barami?
Dr. Tharaq is fine.
Dr. Tharaq, thank you so much. I know I started requesting your presence here since last year, and
Sure.
it's Feb now, and you finally managed to join us. Thank you again. I know you have a very busy clinic.
Thank you.
So I'll just get straight to the point.
Absolutely.
What is back pain? You know, so many of us, we say back pain, back pain, back pain. What actually is it? What's back pain?
Back pain is often referred as the pain in the lower back is usually called as back pain.
Mhm.
And a very large number of population in the world do have back pain. So 500 million have got back pain at given one point of time. So
Wow. Yeah.
back pain is a huge problem.
Mhm.
And inflammation is one of the causes which can give rise to back pain.
Which leads me to ask, how can one distinguish between the normal back pain? I don't know if I should be calling it normal back pain and inflammatory back pain. How can one distinguish?
Probably I would split it as inflammation back pain and maybe mechanical back pain rather than a normal back pain.
Okay, I won't
back
use the
pain-
word normal again.
Back pain from inflammation is different from the nature. A person with inflammation does get morning stiffness. Usually those stiffness takes quite a long time to improve.
Mhm.
And as the day gets on, the pain improves. And they typically have got a early morning stiffness.
Mhm. But then during the day, it tends to disappear.
They tend to ease off
Mhm.
when compared to in the morning.
Mhm.
The later part of the day tend to be better.
Mhm.
And moving our activity improves the pain.
Uh-huh. Uh-huh. I know you've mentioned that the back pain is caused by inflammation, hence inflammatory back pain. So, what are the causes of this?
The causes of inflammatory back pain are multiple, and most often we see is genetic reasons.
Mhm.
If someone has got a family history of inflammation in the back, which said commonly referred to as ankylosing spondylitis, if there is a family history,
Mhm.
then have to think about genetic reasons. There are other individuals with different conditions like psoriasis of the skin or inflammation affecting the eyes called uveitis or iritis can also get back pain.
Interesting. Just to dial back, psoriasis can lead to back pain?
Correct. Psoriasis itself is an inflammation affecting the skin.
Yes.
And those patients who are having psoriasis are more prone to get inflammation in the spine.
Oh, and so other than patients with psoriasis, who else is at risk of inflammatory back pain?
People who have got inflammation in the bowels, like ulcerative colitis and Crohn's disease, can also be more prone for inflammation in the back.
Mhm.
Inflammation affecting the eyes, uveitis, iritis, are common causes.
Mhm. Mhm.
And genetically, there are some individuals, even they don't have psoriasis or have inflammation affecting the eyes or inflammation affecting the bowels, they do get back pain for genetic reasons.
All right. And is it common in both men and women, or it's just common in us women? Because we tend to be the ones who always complain about back pain so much.
When you look at the inflammation, first it was felt that this is more of a problem in men.
Ah.
That was the time when X-rays were only done to look for back pain.
Mhm.
with the advent of MRI scans and more wider use of MRI scans, we see that it's more or less equal
in both men and women.
because we are picking up inflammation with MRI scans often better compared to those when we do only the X-ray.
So let's say someone like me, I have inflammatory back pain, or maybe I'm not sure what kind of back pain it is, but then we suspect it's inflammatory back pain, and I go with it undetected. I don't go to see a doctor. What's the worst that can happen if it goes untreated? Can it impact my life negatively other than the morning pain and stiffness here and there?
Inflammation in the back can affect other areas as well, not restricted to the spine. Some inflammatory conditions affecting the back can affect the lungs or eyes, as we talked earlier. It can affect the work-life quality. And there's a huge economic burden with that because people often with back pain don't tend to turn up for work, giving more rise to absenteeism. There are established studies like proving that there is significant impact on the work and quality. There are a lot of people retiring early.
So what you're trying to say is if somebody were to experience back pain, they should come and see it.
Correct. So earlier, the
earlier the better.
The diagnosis, the better.
Speaking of diagnosis, how do you do this?
There's a lot of delay in diagnosis as well. In UK, studies have shown there is 8 to 9 years delay in diagnosing the condition.
Why?
People turning up late, not having investigations, or rather thinking that this is a mechanical back pain where they didn't sleep properly or the
mattress is not okay. I blame the mattress.
As a rheumatologist, we go through the problems in detail, ask them severity, if they have a family history, and we check whether if they have any associated conditions, which we earlier talked about. And after going through this, if there are more risk factors, we take the next step, doing some supportive blood test, checking for inflammation in the blood. And first step, we tend to do an X-ray to see if there is any damage already happened if it's lasting for years, there might be seeing changes on the X-ray. So an X-ray has got its limitations. An X-ray does not show any inflammation as such, it only shows damage. So those situations, we proceed with further testing with MRI scans where damages as well as inflammation affecting the joints and the muscles can be clearly or better understood.
Now that you've made a definitive diagnosis of inflammatory back pain, what's the course of action? What treatment do you recommend?
There are good treatments available. Though there is diagnosis delay, there are good treatments available to prevent further damage. That's the most important. If one has not tried anti-inflammatories, that is a first start. Trying anti-inflammatories.
Pills, tablets.
Anti-inflammatory tablets. We see them after 4 weeks, see whether they've responded to the anti-inflammatories. If they develop some side effects or they are not good to control, we take the next step.
Which is?
This is caused by inflammation because of immune system is overacting. So the next step is to calm that immune system, which is playing up, and thereby to control the inflammation. And there are good medications to control that.
So again, medications. What is, other than medication, is there any other form of treatment?
Any medical condition has got adjustments needed from various other aspects of life, lifestyle. If a person is overweight, we advise weight reduction. If a smoker, they tend to do badly with the inflammation. So advice was stop smoking.
Smoking is becoming a personal favorite in the podcast, Before it used to be obesity. In the last 4 or 5 times, smoking has jumped in.
We strictly advise on maintaining regular exercises. The spine flexibility is most important in a person's life. Otherwise, it will lead to damage. So regular spinal exercises, swimming or any spinal exercises is highly recommended in people who have got confirmed inflammation. And even those patients who have got disc problems, who don't have inflammation, it's important to maintain the exercise of the spine.
Other than doing exercises at home, does physiotherapy help?
Physiotherapy in a person who is newly diagnosed with inflammation of the spine called spondyloarthritis is very can be very focused. Exercises can be provided by a very specialized physiotherapist. And that's the person can continue when at home. So the first time, if there is a facility, if there is a specialized physiotherapist, we would strongly recommend physiotherapist in the first visits.
In the first few visits, and then they get to learn the...
And then they continue the exercises from home.
The condition, it's inflammatory. Can it be prevented? Can somebody prevent it?
No, this is not anything to do with a lifestyle or a particular food. It is more related to body's immune system. An intervention is not something which can change it happening, rather the course of the disease, the severity of the disease, like smoking cessation, or can help to control, but not to prevent it happening.
Okay. All right. So, doctor, I forgot to ask you, who's more at prone, younger individuals or older individuals?
This condition is more common in younger individuals. It's usually before 40 or 50, you tend to see this more. That would not mean that an older person would not get inflammation in the spine, but this is more often in patients who are younger.
All right, so when you say younger, you mean 35 and below, 40 and below?
No, even early, early 20s or late teens, we come across patients coming with inflammation in the spine. So from late teens, early 20s, anywhere till 45 is the standard we take for that age group of patients who tend to get.
All right, doctor. And you're just based here at King's in Dubai Health, or anyone would like to say it?
Yes. I'm in King's Dubai, and I'll be happy to help and clarify their doubts.
Anything to do with back pain and everything else in rheumatology?
Absolutely.
All right, doctor. Thank you so much for finding the time.
Not at all.
Until next time. You had the doctor, back pain. Make sure you see a specialist about it. It might not just be the mattress or the pillow. It might be something else, something sinister. Until next time, bye.